My name is George Loeb. I'm a patient of Dr. Nezami's. Unlike most patients here, I originally came to see Dr. Nezami because I have chronic kidney disease. When I went to see my family physician and later a nephrologist, they both told me that we waited until I needed dialysis and then they would treat me. And for me, that was unacceptable. Through some various connections and meeting different people, I live in Three Rivers, which is about 75 miles from here. I heard about Dr. Nezami and came to see him to see if he could do something for my kidney disease. I've now been a patient here for about 4 years, and aside from weekly treatments, I live a normal life. I'm not on dialysis. I don't have any restrictions. I can pretty much live my life, which is what I was hoping would happen. Which is a far cry from if I was just followed normal procedure, and as the nephrologist told me that after about 3 to 4 years, I would probably need dialysis and I'd be tied to a machine at this point. I've been here and seen many cancer patients, seen some really amazing success stories. I'm involved with some of the things that go on. I have a PhD in pharmacology, so I'm familiar with some of the things that Dr. Nezami does. I think it's really important that people understand that our current model of cancer is probably wrong, and that some of Dr. Nezami's ideas are some things people really need to look into and think about. We're not killing a cancer. If you're killing a cancer, you're killing your own cells. It's your own body. The idea is to make the cancer essentially normal again and to control its proliferation and allowing the cells themselves to die. So his concept of cancer is a little bit different than what everybody else does, and I think people need to think about what the other physicians tell you to do and what the outcome is. And also, what is the course of your treatment? How do you feel during treatment? I feel, like I said, I have a normal life. I'm not on dialysis tied to a machine feeling sick most of the time. A lot of the patients that I see come here come in feeling terrible, and after a week or so of treatment, they actually feel better, even though they've been treated, where you can't say that for people who are on chemotherapy. If you look at the website, there's, I think, to me, the most dramatic change is the picture of the lady with stage 4 malignant melanoma. In, I believe it's 2 weeks in the pictures, you can see it's gone from a really horrendous looking disease to her back being practically clear of the cancer. This is pretty much unheard of. Other patients here have such as pancreatic cancer and other types of cancer have been seen here and have been treated successfully. In some cases, obviously, stage 4 is not always treatable in the way we think. People come here at the last point looking for miracles. I think if patients came here as their first option instead of the last option, they would have a chance of a real cure, not just putting it off. If you look in the some of the videos that Dr. Nezami has done and look at most other people's websites, you'll find that, yeah, the cancer in remission for a year or two, and then it comes back, and all of a sudden it's far worse than it was before. And Dr. Nezami has explanations for that, and I think he's right on the money. So I think people, if they came here as their first option instead of the last option, they would find they have a real chance of survival.